Well, the measles outbreak renewing a heated debate over vaccinations. The Centers for Disease Control putting out the latest numbers, saying there are at least 102 cases in 14 states across the United States, and some concerns about a real outbreak here. There is a live look at Josh Earnest, the press secretary, fielding some questions today about the president's stance on vaccinations. It's one of the top topics in the press briefing. He describes the president's point of view that getting vaccinations is common sense and keeps our children safe. Joining me now, Dr. Manny Alvarez, Senior Managing Editor for FoxNewsHealth.com and a member of the Fox Medical A-Team, and Dr. Frank Esper, pediatric infectious disease specialist at University Hospital's Rainbow Babies and Children's Hospital. It's great to have you both. Dr. Manny, let me ask you first about the threat and concern of an outbreak here. We've talked a little bit about herd immunity, meaning, in a classroom of 30 kids, if 29 of them are vaccinated, hopefully it protects the one that's not, because most of the herd gets their vaccinations. Right. Are we at a tipping point, or are we close to it where that's actually in jeopardy because there are those that have chosen not to vaccinate?
Well, I think we're getting closer every year. If you look at the state of California, you have over 18,000 kids that have chosen not to be vaccinated by their parents for a multitude of reasons. If the numbers continue to increase, what you said is exactly right. Last year, we had over 600 cases of measles in the U.S., a disease that we knew in 2000 was almost totally eradicated. Now we're seeing an influx, these optics in different regions of the country. So this is something that this whole debate, and I hate that word debate about vaccination safety, has to get off the table. And I don't think politicians are doing a good service explaining that either.
Interesting. Dr. Esper, I'd like your thoughts on that. The word that we're using, of course, is the threat of an outbreak. Is that appropriate here? Some have suggested that no one has died yet, and this is the natural course sometimes of diseases that come back. And eventually, immunity is worked up against it. Talk to us about that.
The answer is this is definitely a numbers game. When you talk about what is the number is 90%. We need to have 90% of people to be vaccinated in order to ensure that we will not have an outbreak or what we call endemic measles. We have been in a measles-free society for about 15 to 20 years now, where the United States has eradicated measles. But that doesn't mean that measles is gone. Measles is all around the world, and in the society that we have, where people are traveling to and fro all over the world, we are always being bombarded by measles. And the shield that keeps our country safe is the vaccination program that we have here, and that we ensure that both the children and the adolescents and the adults remain vaccinated. By doing so, we prevent it from gaining a foothold within this country, and it really has dropped our numbers. While we have only seen 100 cases, we would have seen thousands and thousands of cases if we didn't have such a strong vaccine policy.
And it was certainly millions of cases before we actually had the vaccination program. A final question to you both, and we're cut a little short on our breaking news. But Dr. Manny, to your point, often we talk about the debate on vaccinations. It seems like there's two extremes. Those that say you have to vaccinate, those that say I'm really against it. But certainly there are parents in the middle that just want to do right by their kids and have, some concerns, not necessarily about autism, but about an allergic reaction to vaccination, or maybe doing so much so young to their children. What about that? Is now a time that we can reflect a little bit on the vaccination programs, evaluate them, do better education? What do you think?
When you have two major politicians like Governor Christie says, well, I believe in vaccines, but it should be a choice. When you have Ron Paul saying, well, I like vaccines, but it should be voluntary. That debate doesn't help, because at the end of the day, I think all physicians agree that vaccination is a must, and it saves lives, it saves children, and it's something good for our country, just like the doctor said.
Dr. Esper, your final thoughts?
The answer is what I tell my patients is that, listen, if you are worried about your vaccination, you're worried about the health of your child, the best way to protect your child from the measles is to take the measles vaccine. Straight and simple.
Great to have you both. Appreciate your thoughts. Again, to have you both on the program. Thank you very much.
Thanks.